So BHRC, as we call it, but it's Baltimore Harm Reduction Coalition, started in 2011 as a all-volunteer group that was really working to do policy advocacy and education around harm reduction as a tool to increase health, wellness, and social justice. And so that is what the organization has really kept true to.
So we work for the health, dignity, and safety of people who are targeted by the racist war on drugs and by anti-sex worker policies.
Baltimore Harm Reduction Coalition works on 3 different areas.
We have our direct services to people who need assistance regarding drug use and sexual activity. And then we also have a mobilization area where we're really working for policy changes at every level, including governmental, but not only. And then we have our education work, where we are providing education to providers, to individuals, community members, neighbors, whole host of different audiences.
When I was an employee here at OSI Baltimore, I think it was in maybe 2012 or 2013, that Kima Taylor, who was one of the program officers here, was interested in providing BHRC its first grant because it was volunteer run before that. And I think from then on, BHRC has been a consistent grantee of OSI for, over a decade.
As I dove into this program, a big piece of that was fundraising. And some of the things that we have come to very much appreciate and deeply appreciate is that OSI offers a level of flexibility that few funders do. They really want to see organizations flourish and know that pivoting is a part of that. They know that providing just general support with hopefully the least amount of, paperwork on our end often gets better results than like very intense bureaucratic expectations of grantees. And their interest in providing supplemental support if the program or project comes up. We can always pitch it to them and they will do their best to find ways to support it.
I do communication stuff, and so we were trying to rebrand. And so in that process, we had gone to OSI and asked for help. We worked with Evan and, came up with this like beautiful marketing campaign and started to, put that out into the world. It was so helpful to get somebody else's eyes on it. Like everybody has a place in the movement. Funders have a place in the movement. Communications people have a place in the movement. Direct services people have a place in the movement. It's just really helpful to be able to try to get a holistic view on, for me specifically, on that campaign of how to make sure that we can draw as many eyes to it as possible and show them this is so necessary and so needed.
Over the past 25 years, OSI has really helped to shape and model what it means to be a progressive funder. And it has actually normalized a lot of necessary social justice issues across different communities and conversation.
OSI has been helpful and also will have a lasting legacy whenever it comes to the people that they funded, especially in Baltimore, especially us, is that they've helped people who use drugs. There are groups that are not about it, right? There are groups that are very specifically not about that, and funding that we don't receive to make sure that kind of stuff happens. And so I think it is remarkable that an organization or a funder would take a minute, sit down, see people, and be like, we care about people, we care about the dignity and the humanity of everyone, and in ways that some people don't. And how can we make sure that we can help? And I think that's huge.
I think one of the most significant impacts that I imagine OSI has had on Baltimore is not only their work funding projects and letting ideas, get the backing they need to see if they, can stand on their own and through the fellowship program. But the little bit that I understand is that they've also influenced their peers, right? So other foundations, other funders in the area. And I think that that's really important and cool of them to try to do some advocacy amongst their peers so that other philanthropic, entities might consider funding advocacy, might consider doing things that are not in their normal wheelhouse.
The work that we have done has already been laid down and it's already had a big impact. And we are one organization in one part of the state, right? And so that times how many other people in our little sector, not to mention the people outside of that, you know, I don't know how long we'll be here. I don't know how long the other places will be here, but our impacts on like individuals through that like chain it's going to last, you know, lifetimes.